Please turn on your videos.
Good afternoon, ma'am, and to all my dear friends. The topic that I'm going to present today is diarrhea. Um, uh, Topic diarrhea introduction. Diarrhea is derived from the Greek words meaning flowing through. It is the second leading cause of death in children under 5 years of age. What is diarrhea? Diarrhea is an illness in which the body solid waste is more liquid than usual and comes out from the body most often. Diarrhea is one of the most common health complaints. It can range from a mild temporary condition to a potentially life-threatening. Globally, there is estimated 2 billion cases of diarrhea disease occur each year, and 1.9 million children under age of 5 years in developing countries die from diarrhea. Causes of diarrhea. Diarrhea infections are caused by ingestions of contaminated food and water, contaminated by dirty hands on exposure to facial matter. Also, some germs that pass through enteritis and subsequently diarrhea are caused by bacteria, viruses, and parasites. Um, Bacteria example like Salmonella or Escherichia. Uh, Bacteria that are caused by viruses, example norovirus or rotavirus. Parasites, example Cardia intestinalis. The symptoms of diarrhea. Uh, the person who suffer from diarrhea uh, will will show symptoms like loose watery stool, abdominal cramps, fever, uh, urgent means most of the time they want to go to toilet. Then diarrhea is transmission of diarrhea. Most of the diarrhea agents are transmitted by the fecal oral route. Some viruses, such as rotavirus, can be transmitted through air. Shigellosis or blood dysentery is mainly transmitted from person to person. Treatment of diarrhea. Because most cases of diarrhea resolve on their own within a day or two, self-care to relieve symptoms is usually sufficient for treatment. Avoid dairy products and greasy, high fiber or sugary foods. Placing hot water bottle or wheat pack on your stomach or taking paracetamol may provide some relief from abdominal cramps. Avoid taking non-steroidal anti-inflammatory drugs such as aspirin, ibuprofen for relief pain, as medications can cause diarrhea. How to prevent diarrhea? Washing hands thoroughly after using the toilet. Always put food that could spoil in the fridge. Never eat uncooked food like meat. Avoid eating food from street vendors. Uh, Conclusion: uh, diarrhea and constipation are common disorders of gastrointestinal tract that are often reported by older adults. Pharmacy is essential in counseling patients on self-management. Patients should be instructed to increase fluid intake if they suffer from diarrhea like ORS, clear water. Uh, then the primary health center also should reach every child with effective inventions. Ensure wide availability of low osmolarity ORS. Ensure wide availability and use of zinc. Thank you, ma'am.
Okay. So participants, do you have any question regarding the topic diarrhea? From the participants, any question?
Ma'am,
Yes.
I want to ask Ivan.
Okay. Yes,
Ivan,
ask.
I want to ask. Diarrhea is derived from which?
From Greek word which means flowing through. Keep full means the person always want to go to toilet.
Then what is diarrhea?
Uh, Diarrhea is an illness in which body solid waste is more liquid than usual.
Okay, thank you, Ivan.
Thank you.
Any more question? If no, then Iban, you can ask any 3 questions to the participants. Ask questions.
Ma'am, marbot.
Marbud.
Yes, ma'am.
Okay. Ask Iban.
How to prevent means what should we do to prevent from diarrhea?
Prevent from diarrhea, we have to wash our hand after coming from toilet, and we don't have to eat uncooked like meat. Only that.
Is it correct, Iban?
Yes, ma'am.
Partially correct. Some more answers were there. What are they?
Some more answers: avoid eating food from street vendors.
Okay, and
Disinfect bench tops, stove tops, and chopping boards with a diluted bleach solution.
Okay. Okay, ask one last question. Ask one last
Tashi,
question. Tashi Sumo. Tashi Sumo.
Yes, ma'am.
Okay, ask Iban.
Yes, ma'am.
symptoms. Give any 2 symptoms of diarrhea.
We'll have stomach pain and
Yes,
fever.
yes, correct.
Stomach pain, fever. Okay.
Yes,
Then
ma'am.
what are the symptoms? Loose motion will be there, weakness. Okay. So okay, then it was a good effort, Ivan. Your chart paper is really looking nice.
Thank
Okay,
you, ma'am.
you have you have done it well. Okay, so
Yes.
for your exams tomorrow, prepare well for your exams and all the best to all of you. Okay, it will be a 30 marks questions, all MCQ based. Okay, it won't be that tough, but still you need to study. Okay, okay then. Thank you.
Thank you, ma'am.
Okay.
Thank you, ma'am.
Okay.
Thank you, ma'am.
Mm.